Hi everyone. Welcome back to Tomography Series 2. In this video I will discuss about CT neck plane and contrast. In this I will include all the key factors, like indication, patient preparation, patient positioning and instructions, scan parameters, contrast media, filming, CD and DVD, packs and archive system, radiation safety and protection, and post-procedure instructions. So let's get into the video. Indication: parotid or submandibular gland lesion or infection. Head and neck neoplasms. Pharyngeal, retropharyngeal or tonsillar abscess. Neck mass or abscess. Tongue mass or lesion. Foreign body in the neck or upper airway. Tumors or infections involving the vocal cords. Head and neck cancer therapy response and follow-up. Head and neck trauma. Vascular malformations. Bleeding, epistaxis. Congenital anomalies. Foreign bodies. Thyroid disease. Patient preparation. Allow patient to change into hospital clothes. Always take signed informed consent. NBM status required. Patient should be 4 hours fasting before the procedure. Adequate hydration is to be advised. Patient can have water or clear juice. Check serum creatinine level. Normal range is between 0.6 to 1.2. Always check creatinine clearance. Renal insufficiency guideline is as below. Renal function, normal, GFR above 90. Mild, 60 to 90. Moderate, 30 to 60. Severe, below 30. Any medication allergies allergic to X-ray contrast, iodine. Always ask any history of heart disease, asthma, diabetes, and kidney disease. Female patient with childbearing age, please ensure LMP and confirm non-pregnant status. Remove metal objects including jewelry, eyeglasses, hairpins and nose ring. Remove hearing aids and remove dentures. Take special care with details from elderly, handicapped, deaf, blind, very young, individuals with poor language problem, etc. Patient positioning and instructions. Pre-scan instructions. If patient has a fixed permanent dental implant, then first do plain scan of that region to see the metal artifacts. If artifacts are obscuring the image quality, then abort the scan or use occluder to reduce the metal artifacts. Positioning. Orientation, head first supine. Patient should be straight. Chin should be in neutral position. Center the table height such that the mid part of the neck is at the center of the gantry. Instruction. Before starting the scan, explain whole procedure to the patient so they can understand what they has to do during the scan. Patient neck should be stable, so ask the patient to do not move neck during the scan. Swallow instruction. Tell the patient to do not swallow during the scan. Puff cheek instruction. Tell the patient to inhale deeply with mouth and fill it with air. Then close mouth and puff up cheeks during the scan. Contrast instruction. Explain contrast dye information that after injecting the contrast dye patient may feel a slight burning sensation. Some people experience a metal taste in their mouths and a warm sensation throughout their bodies. These reactions are normal and generally last less than a minute. Scan parameters. Topogram, AP and lateral. Coverage, plain scan, only in region of interest. Contrast scan, from frontal sinus to carina. Scan phase. Plain scan, contrast scan. KV, 120. MAS, 180. Scan mode, helical. Collimation, 0.6 mm. Slice thickness, 3 mm. Slice interval, 3 mm. Pitch, 0.8. Rotation time, 0.5 second. Scan direction, caudocranial. Scan delay, 2 second for plain scan and 40 second for contrast scan. Recons. Recons for plain scan. Recon 1. 3 by 3 mm axial soft for filming. Recon 2. 1 by 0.5 mm axial soft for 3D. Recons for contrast scan. Recon 1. 3 by 3 mm axial soft for filming. Recon 2. 1 by 0.5 mm axial soft for 3D. Image kernel, H30 medium smooth for soft tissue. Image window, larynx for soft tissue. Contrast media. IV contrast status, yes. IV line, 20 or 22 gauge. Contrast flow rate, 1.2 or 1.5 ml per second. Contrast volume, 70 ml. Filming. Film 1. Plane view, plane axial soft only region of interest and contrast axial soft. Slice interval, 3 by 3 mm. Window level. Soft tissue. Window width 250. And window level 50. Film format. 5:7, 35 images. Film 2. Plane view, contrast axial soft. Slice interval, 3 by 3 mm. Window level. Soft tissue. Window width 250. And window level 50. Film format. 5:7, 35 images. Film 3. Plane view, contrast coronal soft. Slice interval, 3 by 3 mm. Window level. Soft tissue. Window width 250. And window level 50. Film format. 7:5, 35 images. Data for CD and DVD. In CD you can give thick data like 3 by 3 mm axial soft plane. 3 by 3 mm axial soft contrast. All reformats and 3D images. Patient's protocol. In DVD you can give thick and thin data like 3 by 3 mm axial soft plane. 1 by 0.5 mm axial soft thin plane. 3 by 3 mm axial soft contrast. 1 by 0.5 mm axial soft thin contrast. All reformats and 3D images. Patient's protocol. Data for PACS and archive system. 3 by 3 mm axial soft plane. 1 by 0.5 mm axial soft thin plane. 3 by 3 mm axial soft contrast. 1 by 0.5 mm axial soft thin contrast. All reformats and 3D images. Patient's protocol. Radiation safety and protection. Always follow ALERA principle. As low as reasonably achievable. Avoid repeat scan. Always check pregnancy status in female patient. If needed, take a consent. Always used radiation protection accessories like lead apron, thyroid shield, gonad shield, etc. It is ideal to use 2 lead aprons, front and back of the patient for radiation protection. Strictly follow radiation safety protocol, especially in pediatric patients. Post-procedure instruction. After the scan, ask patient to drink plenty of oral fluids, 4 to 5 liters for at least next 24 hours. If patient is diabetic, tell the patient to stop metformin-contained drug and restart it after 2 days. Tell the patient to inform referring physician about the same. That's all for this video. Please do subscribe our channel to get notification of our new video.